Okay, so before I enter the room, I would check for precautions, allergies, orders. I also want to say that I already auscultate the patient. I check the oxygen saturation. And after that, I would walk in, knock knock. Hello, Mrs. Smith. I'm Pablo. I'll be your nurse today. I'll be performing trach care and suctioning as well of your tracheotomy too. Can I please have your full name and date of birth? Okay, awesome. Let me check your name tag. Okay, thank you so much. Gonna raise your head a little bit here. And the bed for a comfortable loud hole. Is this okay with you? We are. Then I would check the equipment, such as oxygen and the suctioning device, hand hygiene, glove up. For the purpose of the video, I'm not wearing any PPE, but I would have been wearing mask, goggles as well, or face shield. I would have gloves on, put an absorbent pad to prevent any spillage. And if she coughs out any spitting, it'll be caught in here. So I have done hand hygiene. Oxygen is working. See? Perfect. Before I do anything, I would hyperoxygenate the patient at 10 liters for about 30 seconds. So that's while that's going, I would check for suction. And I will bring the suction up to 80 to 120. Perfect, it's working. Then I'll go back and start my station here. Doing the sterile technique, I'll open my sterile field away from me.
Another thing is this, Kelly, make sure the fenestrated.
And she's already been hyperoxygenated in 10 seconds, 30 seconds. I'll bring the oxygen back down, remove her oxygen out of the way so I can perform the suctioning. Open my sterile field, respecting the 1-inch borders. And before I put the sterile gloves on, I will fill my basin with the saline solution. Bring my station closer. Then with my non-dominant hand, grab the sterile glove without touching it inside.
Yeah, so it was like, don't go too close. It went like this. It was just like this. I remember later. I said, oh my God.
You're feeling okay? The oxygen saturation is good. What I'm gonna do is I'm gonna open the suctioning catheter, and while keeping my right hand sterile, I'll use my left one to connect this. And to make it easier for me to connect, I would just wrap it around my wrist. So I have a better way to connect. Grab the suctioning tube, connect to the catheter, test for patency, press on for suction. Perfect, that's working. Then lubricate the catheter. While exerting no pressure or no suction, go in slowly for about 5 inches or until I see or meet any resistance or the patient's cough. And while I'm in there, okay, I reach some resistance, go back about 1 centimeter, and then while going up slowly, I'll apply intermittent suctioning and go up in a circular motion, spiral motion. And the whole procedure should take about 15 seconds. It's good. After that, I'll wrap this back on my hand, attach, put the tube back in place. With this hand here, toss it. Hand hygiene. Remove all that's left behind. This will be trash, 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 trash.
I would check the orders.
Of course, I wouldn't put in the bag, but just for the sake of the video, I would just leave it in there.
I would have already,
From here,
I already did
I
vital
would have
signs,
done hand hygiene, put the oxygen back on,
auscultated the lungs, and then
bring the
I will make sure that I have the proper
oxygen,
PPE
make sure it's
on
up
as
to
well.
3 liters. That's her
And I'll
order
go ahead- My supplies I've already
per
set
the
in
provider. So
Go
the
ahead and
oxygen is working fine. Toss everything in this trash and move on to the dressing change. Okay, Mrs. Smith, are you okay?
And we're gonna go ahead and
The oxygen
provide,
saturation is good still.
suctioning,
What I'm gonna do
and
now,
also do a
I'm gonna
dressing
clean
change on
your
trachea, alright?
tracheostomy
First, if you could just
too.
go ahead
And I'm also gonna
give me
replace your dressing, okay? I'm gonna give you a
full
fresh
name
one.
and date of birth.
All right. So
Also,
I'm gonna go and
hand
open my
hygiene
sterile
and
food.
privacy. Okay, thank you.
Having done hand hygiene,
Before, I go ahead and check all
grab
the,
my sterile pad, respecting the 1-inch
I'm gonna
border,
go ahead and raise the head of, raise the bed up
and
to
make
a
sure,
comfortable height
making
for
sure
myself.
that
And then also put the patient in a semi-collar.
the
to
shiny
follow
side is
position.
facing down. Perfect. These are my sterile gloves. Put them to the side for the moment.
So I'm gonna go ahead and check, the oxygen.
Keeping my
tank, see if
field
there's any
sterile.
kinks. Also make sure that it's on the
Use sterile
proper
gloves.
oxygen level, which it is, it's 3 liters currently. Also has humidifier on there.
Fill my
And I'm gonna
basin.
check, suction just to make sure it
Fill
works
my
well.
basin with saline.
We do want suction to be between 80 and 120.
Replace an absorbent pad for the procedure.
So do some hand hygiene, gloves on.
Or remove the oxygen. Apply sterile gloves.
Go ahead and put either a towel
These are
or
a
just,
bit tricky, so
these underneath.
for the sake of the video, I'm gonna pretend that I'm wearing the sterile gloves. I'm actually gonna get the help of my assistants,
I go ahead and
Jing here.
The
Gonna put
patient,
on
for about
what would have
30
been
seconds to a minute,
sterile gloves.
Double checking the pulse oximetry, just make sure.
So here we are.
And I can bring it back down once they've been hyperoxygenated.
Sorry if I'm making this look bad, but
This
it's
kit's
just
already
my
been
hands are
opened, so-
very big and the sterile gloves are very tricky to put on.
That wouldn't be the normal.
Okay, from here, I would keep this hand sterile and this one. With this one here, the left side, the left hand, I would unlock it,
Put in some sterile.
remove the inner cannula, toss it in the saline, and start the cleaning. Go clean on the inside, also on the outside. Toss
My
it.
gloves.
Then I
for
would
hygiene.
dry on the inside, toss it, dry it on the outside, and then with the same hand in an angle, insert the inner cannula, lock it in place, remove the old dressing and toss it. With my sterile hand, put the new clean dressing on the side. Start cleaning around the stoma in an outward motion from the stoma out. Toss it.
Now I have my sterile gloves on.
Second on the other side, same deal from the stoma out. Toss it. Use one of the
Measure, typically we are inserting 4 to 5
gauze that we
6
have
inches, so I'm just gonna kind of
to
measure
clean
with
it
my hand, get that all
around the
ready.
stoma in an outward motion from the stoma out. Toss it.
Go ahead
Another one on the other side, on the larger areas, and toss it.
and turn on suction again.
Grab another
80 and
piece of gauze
120.
and just dry it out, toss it. And from here, I would replace the dressing with a new,
I'm
fresh
gonna go
and
ahead
clean
and
one.
test the suction, and then
This hand is still
also
sterile,
lubricate
so
it at the same
use
time.
this side here and push it in.
And
Same
then,
thing with
as we insert,
this side.
do not apply suction going again 4 to 6 inches until you feel resistance or the
and going very
patient
easy,
stops, and then we'll
making
go ahead
sure
and,
that you don't move the
pull back
actual
1 to
tubing.
2 centimeters.
Is this okay, Mrs. Smith? All right, dress is in place.
Pull back a little bit.
Looks good. And while I'm doing this, I'm watching for the looks of the stoma, if there's any redness or any swelling. And from then, I would just replace the string that secures tracheostomy tubing in place. Part of my reach here, Mrs. Smith.
Reapply
I'll be out of your
oxygen.
waist
Make sure that it's on the 3 liters, which it is.
as soon as I can. I know this is bothersome. And then I'll go on this side here and grab it on this side. And tie it on a slip knot that's easy to remove. Is this comfortable?
I'm gonna go ahead and
You have enough slack here?
do
Good.
hand hygiene,
From
get rid of
here,
my other
I
supplies
would
and get ready
give
for
her back the
dressing
oxygen.
first.
Always checking the saturation. Get rid of the trash.
Hand hygiene again.
Toss everything that doesn't belong here. Remove gloves. Hand hygiene. Mrs. Smith, how did the procedure went? Do you feel anything? Is it
How you
painful?
doing, Miss Smith? Good.
So I would
Again, I would be checking the oxygen
put the bed
saturation
down
just to make sure that I don't need
to a
hyperoxygenate
comfortable position,
and,
into a safe
before
position as well.
dressing. And if I do, I'll go ahead and do the same
Make
thing.
sure the call
That
eye
way,
is within
wait a couple
reach.
minutes between.
Bring the oxygen back to the 3 liters that's her order. Clean up
Again,
the
we'll
station.
go ahead and put,
Document
spare
any
towel or a
how the
sheet.
procedure went,
if it
how
ends,
Mrs.
it'd be
Smith,
5 seconds.
if she had any questions or concerns, how the stoma looked, if we had any specific looks to, redness or swelling, a specific odor to. I would also auscultate, as I did previously, her lungs, check the saturation, walk out of the room and document it. And I'm done.